The microenvironment has always fascinated me. I was not even in grad school yet. And I heard Mina Bissell give a talk where she showed a cell that she had taken from the prostate and put in a mammary microenvironment. And that cell actually started producing milk, which I thought was the most fascinating experiment I'd ever seen.
Professor Ashani Weeraratne has been studying the cellular microenvironment in her lab for the past 17 years. Cells don't live in isolation. The other cells, molecules and blood vessels in their surroundings can have a powerful effect on their behaviour. And this is especially important when it comes to cancer.
So the tumor microenvironment is really the neighbourhood in which the cells sit. They sit in a network of matrix and mesh, and they have other cells that are around them, and the impact and the crosstalk of those cells with the tumor cells can have a huge impact on the behavior of the tumor cells outside of genetics. My lab and others are looking at the impact of aging of normal cells in the tumor microenvironment and how those impact cancer development and progression. It's such an obvious thing that cancer and aging go hand in hand. And yet, despite that, until we really started digging around, I don't think even I realized how important it would be to understand what those changes are and how we can target them.
Cancer is often defined as a disease of aging, and the vast majority of cases occur in people over the age of 50. As global populations live longer, cancer is set to become a major public health burden. So how does an aging microenvironment around a tumour affect cancer progression?
What we're finding is that the cells that are aging normally, as they're supposed to do, around the tumor cells are sending signals to those tumor cells that make them more metastatic and more invasive and more resistant to therapy. For example, if you look at the skin, we see collagen that is nice and firm and very dense in younger skin, but that we lose that density and that firmness in aged skin. And that provides ways for tumor cells to move differentially through that collagen. Also, immune cells. The immune system changes dramatically as we age. And what we're finding is that there are changes that are both beneficial as well as detrimental in the aged tumor microenvironment. So, for example, in melanoma, patients are often treated with therapies that boost the immune system, so immunotherapies, and we find that older patients actually respond much better to immunotherapy such as anti-PD-1 than younger patients because they don't have the same level of regulatory checkpoints that younger patients tend to have. So one of the things we've been most excited about recently is the fact that we have found changes that occur in tumor cells that we put into aged microenvironments rather than young microenvironments. And we can actually target those changes. We see those changes in patients, and when we target them in mice, we can overcome therapy resistance and reduce metastasis. And so that is fascinating, and we're hoping to push that into clinical trials over the next few years.
So are researchers currently paying enough attention to the effects of the aging tumour microenvironment?
As a community, we're not really taking the aging microenvironment into account. We are designing preclinical studies that are all based in 6 to 8 week old mice. We don't really tailor our therapies from young to older patients. Our work has revealed that older patients respond very differently, even to targeted therapy. So that has been a really fascinating finding for us, because one of the early experiments that we did was to take genetically identical tumors that bore a mutation that we could target. And yet when we put the same tumors in either a young mouse or an aged mouse, what we saw was that the tumors in the aged mice, despite the fact that you had one gene and one drug to target that gene, behaved completely differently. I think one of the most important milestones we're going to see over the next 5 to 10 years is the movement of some of this work into the clinic. So, for example, the target that I was speaking of earlier is a target that we can make a drug for, which we are doing, and then get into patients in the clinic. I also hope that people will start thinking about designing preclinical studies in young and aged mice. We're beginning to show that there are differences in older females and older males. So I think that's going to be an area of great importance as well. And finally, really what I'd like to see is the way we treat patients, how important it is to treat them according to their age.